A 73-year-old man begins losing weight. At first, he is pleased. He has not changed his diet. He has not started exercising more, but his trousers feel looser and the number on the scale keeps dropping. Then, his appetite changes. He sits down for dinner, takes a few bites, and feels completely full. A dull ache appears under his ribs and sometimes reaches into his back. His urine looks darker than usual, but he assumes he needs more water. Each symptom seems small by itself. Together, they tell a very different story. I am Dr. George White, and pancreatic cancer is one of the most difficult cancers to detect early because the pancreas sits deep inside the abdomen. You cannot feel it from the outside. A routine physical examination may not reveal anything, and early symptoms can look like common problems such as indigestion, back pain, fatigue, diabetes, or normal changes in appetite. That is why many people wait. They blame age. They blame a heavy meal. They blame arthritis. They blame stress. And by the time the symptoms become impossible to ignore, the disease may already be advanced. But I want to be careful from the beginning. Having one of the symptoms in this video does not mean you have pancreatic cancer. Most of these symptoms can come from many other conditions, including gallstones, liver disease, ulcers, infections, medication side effects, diabetes, and ordinary digestive problems. The important thing is the pattern, a new symptom that persists, several symptoms appearing together, a change that is becoming worse instead of better. Those are the situations that deserve medical attention. Today, I will explain 8 warning signs seniors should never ignore. I will also tell you which symptoms require urgent care and how to describe them clearly so your doctor understands the full picture. The first warning sign is persistent dark urine. Urine naturally becomes darker when you are dehydrated. If you have not had enough water, your urine may look deep yellow. After drinking fluids, it should usually become lighter, but urine that stays unusually dark, becomes brown, or looks like strong tea can sometimes be connected to a buildup of bilirubin. Bilirubin is a yellow substance created when the body breaks down old red blood cells. The liver processes it, and bile carries it into the digestive system. The pancreas sits close to the bile duct. If a tumor grows in the head of the pancreas, it may press on or block that duct. Bile cannot flow normally. Bilirubin then builds up in the blood, and the kidneys begin removing more of it through the urine. That can make the urine appear dark. But pancreatic cancer is not the only cause. Gallstones, hepatitis, medication effects, liver disease, and other bile duct problems can produce a similar change. So, what should concern you? Dark urine that keeps returning even when you are drinking enough. Dark urine appearing with pale stool. Dark urine with yellow eyes or skin. Dark urine with itching, abdominal pain, nausea, or unexplained weight loss. That combination needs medical evaluation. Do not rely only on drinking more water for several weeks. If the color remains abnormal or keeps returning, call your healthcare provider. Now, before we move to the second sign, subscribe to this channel if you are over 60 or care for someone who is. These videos are designed to help older adults recognize changes early, ask better questions, and avoid dismissing serious symptoms as normal aging. Your subscription helps this information reach another family who may need it. The second warning sign is pain in the upper abdomen that travels into the back. Back pain is extremely common after 60. Arthritis, muscle strain, spinal problems, old injuries, and poor posture can all cause it. That is why pain connected to the pancreas is so easy to dismiss. Pancreatic pain often begins in the upper abdomen, beneath the breastbone, or slightly toward the left side. It may feel dull, deep, or difficult to locate. Then it may travel through the body into the middle or upper back. Some people describe it as a band of pressure around the upper abdomen and back. Others say it feels like pain coming from deep inside, rather than from the muscles near the skin. There are a few details worth noticing. The pain may become worse after eating. It may become worse when lying flat. Some people feel slightly better when leaning forward. It may return in a similar pattern day after day, and ordinary treatments such as rest, heat, or common pain medicine may not fully relieve it. Again, this does not prove cancer. Pancreatitis, gallstones, ulcers, reflux, kidney problems, and spinal conditions can cause similar pain, but pain that is new, persistent, worsening, or combined with appetite loss, jaundice, weight loss, vomiting, or stool changes should be investigated. When you speak with your doctor, do not simply say, "My back hurts." Say where it begins. Explain whether it moves from the upper abdomen into the back. Mention whether meals make it worse. Say whether lying flat changes it. Details guide the investigation. The third warning sign is feeling full after eating only a small amount. Appetite often changes with age, but becoming full after only a few bites is different from simply not feeling hungry. This symptom is called early satiety. The pancreas sits behind the stomach. A mass in or around the pancreas can sometimes affect nearby organs, interfere with normal digestion, or create pressure that makes the stomach feel full quickly. The pancreas also produces digestive enzymes. These enzymes help break down fats, proteins, and carbohydrates. If the pancreas is not functioning properly, or if its ducts are blocked, digestion may become less efficient. Food can feel heavy, nausea may develop, meals that were once comfortable may cause bloating or discomfort. You may begin leaving half the meal untouched, then weight begins to fall. Many seniors celebrate unexpected weight loss because they have been told that being lighter is always healthier. But unintentional weight loss is different. If you lose several pounds without trying, especially over a few weeks or months, your doctor needs to know. The concern becomes stronger when weight loss appears with early fullness, abdominal pain, pale stool, dark urine, weakness, or a new change in blood sugar. A simple rule is this: weight loss you planned can be progress. Weight loss you cannot explain is a symptom. Do not dismiss it as a smaller appetite or a faster metabolism. Now, here is an important rehook. The first three signs can hide behind common explanations: dehydration, back pain, and reduced appetite. But the next sign is visible, and when it appears with dark urine, it often points toward a blockage involving the liver, gallbladder, bile duct, or pancreas. The fourth warning sign is jaundice. Jaundice means the skin or the whites of the eyes become yellow. In darker skin, the change may be easier to notice in the eyes, inside the mouth, or on the palms. Jaundice happens when bilirubin builds up in the body. If a pancreatic tumor blocks the bile duct, bilirubin can rise, but gallstones and liver disease are also common causes. Jaundice may appear with dark urine and pale, gray, or clay-colored stool. It may also cause intense itching. This itching is often different from dry skin. It may affect large areas of the body. There may be no obvious rash. Lotion may not help. The itching can become worse at night and may feel deep or relentless. Yellow eyes or skin should never be ignored. This is not something to monitor at home for several weeks. Contact a healthcare professional promptly. If jaundice appears with fever, severe abdominal pain, vomiting, confusion, or shaking chills, seek urgent medical care because a blocked or infected bile duct can become dangerous quickly. Do not assume jaundice is only gallstones. Do not assume it is cancer either. The point is that jaundice needs a proper evaluation. The fifth warning sign is an unexplained blood clot. This is not the most common sign, but it is important because some cancers, including pancreatic cancer, can make the blood more likely to clot. A deep vein thrombosis usually forms in a deep vein of the leg. One calf or thigh may become swollen. The leg may feel warm. There may be redness or a change in color. The pain may feel like a deep ache, tightness, or heaviness. Sometimes there is little pain, which is why swelling in one leg should not be ignored. The danger is that part of the clot can break loose and travel to the lungs. That is called a pulmonary embolism. Warning signs include sudden shortness of breath, sharp chest pain, coughing blood, fainting, sudden dizziness, or a rapid heartbeat. Those symptoms require emergency help immediately. Call emergency services. Do not drive yourself. Now, most blood clots are not caused by pancreatic cancer. They may follow surgery, bed rest, long travel, injury, hormone medication, or other medical conditions. But if a clot appears without a clear reason, especially in an older adult, doctors may consider whether another condition is increasing the tendency to clot. That does not mean every unexplained clot requires a scan of the pancreas. The decision depends on your history, symptoms, examination, and other tests. But the clot should not be treated as an isolated event without asking why it happened. If you have had an unexplained blood clot and also have weight loss, abdominal pain, jaundice, appetite loss, or digestive changes, make sure your doctor knows about the whole pattern. If you are finding this information useful, subscribe now and turn on notifications. Many serious illnesses are missed not because the symptoms are invisible, but because people do not know which details belong together. This channel helps seniors recognize those patterns before valuable time is lost. The sixth warning sign is a new change in blood sugar or diabetes. This one surprises many people. The pancreas produces insulin, the hormone that helps control blood sugar. When the pancreas is affected by disease, insulin production and blood sugar control can change. Some people develop diabetes later in life with no clear explanation. Others who already have diabetes suddenly find that their blood sugar becomes much harder to control. Their readings rise even though their diet and medication have not changed. They may become more thirsty, they may urinate more often, they may feel more tired, they may lose weight instead of gaining it. Most new diabetes after 60 is not caused by pancreatic cancer. Type 2 diabetes is common and has many causes. But a new diagnosis of diabetes in an older adult combined with unexplained weight loss, abdominal pain, jaundice, or appetite changes deserves closer attention. The same is true when long-controlled diabetes suddenly becomes unstable. Do not panic if one blood sugar reading is high. Look at the trend. Are fasting numbers rising repeatedly? Is your A1C increasing? Are you losing weight without trying? Has your appetite changed? Are other symptoms appearing? Tell your doctor about the complete pattern. This may lead to medication adjustment, additional blood work, or imaging if your healthcare team believes it is appropriate. The seventh warning sign is severe fatigue that does not improve with rest. Everyone feels tired sometimes. Poor sleep, stress, anemia, medication effects, thyroid disease, depression, infection, heart problems, and many other conditions can cause fatigue. Cancer-related fatigue is not always easy to separate from those causes, but one feature often stands out. It feels out of proportion to the activity. A person sleeps through the night but wakes exhausted. A shower feels like work. Walking to the mailbox requires a rest. Carrying a light grocery bag feels unusually difficult. The person may describe the body as heavy. Rest does not restore normal energy. Pancreatic cancer can contribute to fatigue through inflammation, poor nutrition, blood sugar changes, anemia, pain, sleep disruption, and the body's increased energy demands. But fatigue alone is very nonspecific. The warning becomes more meaningful when fatigue appears with weight loss, reduced appetite, jaundice, stool changes, abdominal pain, or a decline in normal daily ability. Do not let anyone dismiss a sudden, severe change in energy simply because you are older. Aging may reduce stamina gradually. It should not cause a rapid collapse in your usual strength over a few weeks. If you have gone from functioning normally to struggling with basic tasks, arrange a medical evaluation. The eighth warning sign is a persistent change in stool. This is one of the most useful digestive clues, but many people feel embarrassed discussing it. Your stool can reveal how well bile and pancreatic enzymes are reaching the intestines. Normally, bile gives stool its brown color. If the bile duct is blocked, stool may become pale, gray, or clay-colored. The pancreas also produces enzymes that help digest fat. If too few enzymes reach the intestine, fat may pass through without being fully absorbed. This can cause stool that is greasy, oily, bulky, unusually foul-smelling, difficult to flush, or floating repeatedly. One floating stool is not a diagnosis. Stool can float because of gas or something you ate. The concern is a persistent pattern, pale color, greasy appearance, oil in the toilet water, very strong odor, frequent loose stool, weight loss, nausea after fatty meals, bloating or discomfort after eating. These changes can also happen with gallbladder disease, liver problems, celiac disease, chronic pancreatitis, infections, medication effects, or other digestive conditions. But they should not be ignored. Take note of when the change started. Notice whether it happens after every meal or only after certain foods. Tell your doctor about the color, texture, and frequency. You do not need to feel embarrassed. This information can be medically important. Now, let us bring the 8 warning signs together. Persistent dark urine. Upper abdominal pain that reaches the back. Feeling full after only a few bites. Unexplained weight loss. Yellow skin or eyes with itching. An unexplained blood clot. A new change in blood sugar. Severe fatigue. And pale, greasy, or floating stool. You may have noticed that this sounds like more than 8 because some symptoms naturally appear together. That is exactly the point. Pancreatic cancer is rarely identified by one isolated complaint. The pattern is what matters. Dark urine alone may be dehydration. Back pain alone may be arthritis. Fatigue alone may be poor sleep. But dark urine, pale stool, yellow eyes, weight loss, and upper abdominal pain together require urgent investigation. Here is another combination that should not be dismissed. New diabetes, unexplained weight loss, and persistent abdominal or back pain. And another, early fullness, greasy stool, weakness, and continuing weight loss. Do not try to diagnose yourself from combinations on the internet. Use them to decide when a medical conversation should happen sooner rather than later. Now, I want to explain what usually happens when a doctor evaluates these symptoms. The doctor may begin with a physical examination and blood tests. These may include liver tests, bilirubin, blood counts, kidney function, glucose, and other markers. Depending on the symptoms, imaging may include an abdominal ultrasound, CT scan, MRI, or a special form of imaging focused on the pancreas and bile ducts. No single blood test can confirm pancreatic cancer. There is a marker called CA19-9, but it is not reliable enough to diagnose pancreatic cancer by itself. It can be normal in some people with cancer and elevated in people with other conditions. That is why symptoms, imaging, and specialist evaluation matter. Do not demand one specific test based only on a video. Instead, explain the symptoms clearly and ask what evaluation is appropriate. Now let us talk about screening. Unlike breast, colon, or cervical cancer, there is no routine screening test recommended for every average-risk adult to find pancreatic cancer early. Screening may be considered for some people with strong inherited risk, certain genetic syndromes, or several close relatives with pancreatic cancer. If pancreatic cancer runs strongly in your family, ask whether genetic counseling or a high-risk pancreatic screening program is appropriate. But for most seniors, the best protection is not routine scanning. It is recognizing persistent symptoms and reporting them accurately. This is why the words you use at the appointment matter. Do not say, "My stomach has been off." Say, "I have had upper abdominal pain for 3 weeks. It travels into my middle back and becomes worse after meals." Do not say, "I am eating less." Say, "I feel full after 3 or 4 bites and have lost 10 pounds without trying." Do not say, "My urine looks funny." Say, "My urine has repeatedly looked brown despite drinking enough water, and my stool has become pale." Specific descriptions help your doctor understand the seriousness and choose the right tests. Before we continue, subscribe if you have not already. This channel is not built on frightening you with vague symptoms. It is built on teaching you how to describe changes clearly, recognize emergencies, and work more effectively with your healthcare team. That kind of information can protect both time and independence. Now, which symptoms require emergency care? Sudden shortness of breath, chest pain, fainting, or coughing blood may indicate a blood clot in the lungs. Call emergency services immediately. Yellow skin or eyes with high fever, shaking chills, severe abdominal pain, vomiting, or confusion may indicate a dangerous infection or blockage. Seek urgent care. Severe weakness, dehydration, inability to keep fluids down, black stool, vomiting blood, or severe worsening pain also requires prompt medical attention. Do not wait for a routine appointment if you are acutely unwell. For non-emergency symptoms, make a written list. Include when each symptom began, how often it occurs, whether it is becoming worse, how much weight you have lost, whether eating changes the pain, whether your urine or stool color has changed, whether your blood sugar has become harder to control. Bring your medication list. Mention any family history of pancreatic, breast, ovarian, prostate, colon, or other cancers, because some inherited risk conditions can involve several cancer types. Now, I want to correct one dangerous idea from many online videos. They often suggest that nearly every person watching already has one of these symptoms, and therefore may be in immediate danger. That is not responsible. These symptoms are common. Most people with fatigue do not have pancreatic cancer. Most people with back pain do not have pancreatic cancer. Most people with indigestion do not have pancreatic cancer. But common symptoms become important when they are new, persistent, unexplained, worsening, or appearing together. That balanced message is more useful than panic. Fear can make people avoid doctors. Clear information helps them act. Let me give you an example. Imagine a woman named Helen, age 70. For 2 months, she has felt full quickly. She has lost 9 pounds. She notices that her stool has become lighter and harder to flush. Then her daughter sees that the whites of her eyes look slightly yellow. Any one of these signs might have been dismissed, but together, they point toward a problem involving bile flow, digestion, the liver, gallbladder, bile duct, or pancreas. Helen does not need to decide which one. She needs medical evaluation. Now imagine a man named Robert, age 68. He has had back pain for years, but this pain is different. It begins in the upper abdomen, reaches through to the back, and becomes worse after meals. His blood sugar has also risen sharply, and he has lost weight. The fact that he had previous back pain does not mean this new pattern is the same. Changes deserve attention. Your body often communicates through different pain, different fatigue, different digestion, different appetite, different stool, different blood sugar. When something feels unlike your normal pattern, do not let age become the explanation for everything. Now, can pancreatic cancer be prevented? Not every case. Some risk factors cannot be changed, including age, genetics, and family history, but several risk factors can be reduced. Smoking is one of the most important preventable risks. If you smoke, quitting matters at any age. Maintaining a healthy weight may help because obesity is associated with higher risk. Regular physical activity supports weight, blood sugar, and overall health. Limiting heavy alcohol use may reduce the risk of chronic pancreatitis, which can increase pancreatic cancer risk. Managing diabetes and following medical advice for chronic pancreatitis are also important, but do not believe any food, supplement, detox, or bedtime routine can guarantee prevention. There is no proven fruit, vitamin, or herb that makes you immune to pancreatic cancer. Be cautious with anyone promising that. The strongest approach is risk reduction, symptom awareness, and timely medical care. Now, let us review what not to do. Do not ignore repeated dark urine. Do not treat persistent upper abdominal and back pain for months without evaluation. Do not celebrate unexplained weight loss. Do not dismiss yellow eyes or pale stool. Do not ignore swelling in one leg. Do not assume sudden diabetes changes are always your fault. Do not call severe fatigue normal aging without looking for a cause. And do not feel embarrassed describing stool changes. Those details may help your doctor see the whole picture. If you recognize one mild symptom that has been present only briefly, monitor it and discuss it appropriately. If you recognize several symptoms together, call your doctor soon. If you have emergency symptoms, seek urgent help. That is the action plan. Not panic, not denial. Action. If this video has helped you understand these signs, subscribe to the channel before you leave. Every week, I share health information specifically for adults over 60 using clear language and practical steps. Subscribing helps another senior find this information before they dismiss a serious change. Share this video with someone who keeps calling unexplained weight loss a good thing. Share it with someone whose back pain has changed. Share it with an adult child caring for an older parent. The purpose is not to frighten them. It is to help them notice patterns. Pancreatic cancer is difficult to detect early, but difficult does not mean impossible. Your role is not to diagnose it. Your role is to notice what is new, record what is changing, and speak up when the pattern does not make sense. Your doctor cannot investigate a symptom they never hear about. So pay attention to your body. Describe changes clearly, and never let someone tell you that every serious change is simply part of getting older. This video is for education only and does not replace personal medical advice. Most of the symptoms discussed can have causes other than pancreatic cancer. If you have persistent or worsening symptoms, speak with a qualified healthcare professional. If you develop sudden shortness of breath, chest pain, fainting, severe jaundice with fever, confusion, or intense abdominal pain, seek emergency medical care.